Hamida, a Rohingya refugee from Myanmar, was about to give birth to her third child in a refugee camp in Jakarta. One night, she suddenly experienced intense abdominal pain. However, Hamida didn't know the medical helpline, and she had to endure excruciating pain as she and her husband made their way to the nearest small clinic. The doctor at the clinic diagnosed Hamida with contractions and bleeding, and determined that a normal delivery was not possible due to the baby's large head size. However, since they can't read the diagnosis, the doctor had to resort to gestures to explain that they needed to perform a cesarean section, which means to cut open her belly. This left them feeling fearful. They didn't have medical insurance in Jakarta, and they hesitated to trust a doctor who spoke an unfamiliar language and worshipped a different deity. Moreover, the doctor's attempts to stress the urgency of the situation almost led to conflict. Tragically, both Hamida and her unborn child lost their lives as a result of the insistence on a normal delivery. These heartbreaking incidents serve as a serious reminder that refugees require more than just financial and material aid. It underscores the critical need for accessible and reliable information, psychological support, and effective communication assistance. Here, we proudly present ourselves as the Qiangsheng Group of Nanjing University, and we are here today with a tangible solution. The healthcare challenges faced by refugees in Jakarta are dire, exacerbated by lack of comprehensive tracking data that leads to misalignment of medical resources. Shockingly, a survey conducted by a humanitarian aid association has revealed that only 30% of those essential supplies reach the most vulnerable ones, leaving a significant gap in their access to vital care. Compounding these challenges is the limited access to vital information faced by refugees living in isolated camps. Language barriers and religious differences hinder their awareness of available assistance. Consequently, they often remain unaware of the support they require and where to seek it.
It's evident that a comprehensive solution is urgently needed to address these complex healthcare challenges faced by refugees. A digital platform that integrates tracking data, bridges communication gaps, and empowers accessible information would empower both refugees and healthcare providers. This platform would be accessible to government, hospitals, communities, and refugees. In the meanwhile, it would create multiple ports for medical treatment processes, insurance services, and volunteer assistance. Through this platform, certified refugees can register and provide relevant personal information, including medical history, design help, and other essential details. This information would be used to analyze and visualize refugees' medical demands, providing a comprehensive understanding of the gap between supply and demand. With help of the data, we can create a more problem-oriented approach to providing assistance and maximize the efficiency and comfort level of medical treatment for refugees.
The government's involvement in this platform is instrumental in ensuring comprehensive support for refugees in Indonesia. It can offer universal health insurance coverage to refugees in Indonesia through JKN, Social Insurance System of Indonesia. The government can also reduce or even waive the monthly fee depending on the situation of the refugees. Additionally, with extra information that refugees share, it can also help arrange suitable job opportunities for refugees based on their skills and physical capabilities. The local community in Jakarta plays a pivotal role in supporting refugees as they adapt to their new lives. Volunteers, including university students, assist with daily tasks, providing language translation and facilitate cultural integration. The community can also extend legal assistance for refugees facing injustice and navigating a legal system. By closely collaborating with refugees and understanding their unique needs, the local community offers essential support, fostering a sense of welcome and belonging. Hospitals contribute to the platform by establishing designated refugees corridors, ensuring convenient access to medical services for refugees. Special doctors proficient in language of refugees are assigned to provide one-to-many support and real-time monitoring of refugee patient conditions. Additionally, psychological counseling services are available to alleviate mental stress and disorder of patients. Medical expenses not covered by JKN's basic insurance can be covered by the private foundation, including treatment for major diseases.
Through the collective effort of refugees, government, communities, and hospitals, we can create a sustainable and effective healthcare system that provides essential care to those who need it most.
In the first place, starting from June 15th, we will collect information and contact with all parties concerned. Next, we intend to achieve cooperation with an IT company, recruit volunteers and train staff, preparing for the formal construction of the platform. Then we will spend 45 days for platform construction work. Most of the work will be done by the IT company, with certain help from volunteers. If everything goes well, we will finish it by August 30th. Next, it will take about 30 days to work for the initial promotion of the platform. The preliminary work to build the platform is expected to cost about $106,000 in total. Another portion of the budget will be used to maintain the platform later. We will prepare a budget of $94,000 for this part to make sure the platform could run at least 1 year without donations.
Hamida's story mirrors that distrust and cultural barriers are impeding refugees from accessing medical healthcare. We have devised the following measures to bolster trust. Firstly, we aim to foster understanding by offering transparent information about our platform. This includes sharing comprehensive details about our background, business operations, legal information, privacy policies, and non-disclosure agreements. And secondly, we also endeavor to instill confidence in our users by upholding the security and privacy of patients' personal information and medical records through robust security measures. These measures encompassing implementing SSL certificates and data encryption to safeguard against unauthorized access. And finally, we will cultivate a long-term relationship with users by offering continuous support and communication throughout the medical service process. This includes regular health lectures, necessary guidance, evaluation, and follow-up to ensure maximum user satisfaction. To proactively address cultural issues, we have devised a comprehensive plan encompassing the following pivotal steps. Firstly, implementing AI-driven technology. We will embark on developing a sophisticated multilingual platform. We will collaborate closely with dedicated translation volunteers, aiming to ensure its widespread accessibility for refugees hailing from diverse cultural backgrounds. And next, we will conscientiously gather information about users' religions and cultural affiliations. This data will enable us to deliver personalized medical services and deeply respect their individual beliefs and values. And next, we will provide comprehensive cultural training to healthcare practitioners, including doctors and platform developers. This specialized training will equip them with deep understanding of diverse customers and medical requirements. By embracing a humanistic approach, our platform will pave the way for compassionate and culturally responsive healthcare. The lives of Hamida and her child can never be brought back, leaving us with profound regret. To prevent such tragedies from recurring, it's urgent to establish the platform for refugee healthcare. Such every facet of society could make meaningful and impactful contributions. We fervently aspire for all refugees to lead lives adorned with dignity and a profound sense of belonging.